Hey, did you sleep grounded last night? I hope you were able to sleep grounded, and I hope you felt a difference. Some people feel an immediate difference and some people don't. And regardless of if you feel a difference or not, your body is having change. It's affecting change. And on a physiologic level, your body is receiving health benefits from sleeping grounded all night long. So I hope that you were able to do that. Today, let's talk about the impact that grounding and touching the earth has on your heart. As you know, your cardiovascular system is all electrically based. It's all driven by the electrical impulse of the heartbeat, and that heartbeat drives circulation through your entire body. So if you've noticed, every single day is a biggie. Like when we talked about the connective tissue system, it's huge that the connective tissue system connects and interconnects all of our organs together, and it's directly conductive of healing energy and healing flow from Mother Earth. Then when we talked about the central nervous system, the whole basis of the impulses of the central nervous system and the basis of our neurologic functioning is electrical. So the resonance there, so the connective tissue is a conduit, and the central nervous system has a resonance. And with the heart, it's the same thing. This is a big one too. There's nothing really that isn't majorly impacted by the soothing, calming connection that you get with the earth, which is why it's so important to understand. Now, on so many different levels, this is life-changing. The heart's no different. So let's just get started. The first study I want to tell you about today is, we're just going to start superficial and we're going to go deeper and deeper and deeper into the science. So the most superficial study just looks at skin blood flow. So this study had 40 patients. Half were truly grounded and half thought they were grounded. It was a double-blind placebo study. They all had electrical patches, electrodes connected to their feet, and they were grounded for 1 hour, or sham grounded for an hour. And they had this imaging study on their facial skin capillaries, and they literally in real time watched the blood flow. And after 1 hour, they reported that all of the grounded patients had increased, significantly statistically increased capillary blood flow in their facial skin, even though they were attached to the grounding connection through their feet. Again, all the way up in their face, improved blood flow all the way down to the tiniest capillary layer. And the ones that were ungrounded were unchanged. So it wasn't something that you could reproduce or think your way through or be a placebo effect. This was real physiologic change in the circulatory system all the way up in their facial skin. If you think about it, that has ramifications for in the beauty industry and in anti-aging. And think about sleeping all night long grounded and how that would enhance the blood flow through your face and through the skin all over your body, and help repair and restore any damage that you had, any damage from the environment, any damage from products that you put on your skin that aren't healthy, any damage from toxins and additives and preservatives and makeups and body lotions and shampoos and hairsprays. But all night long you have enhanced blood flow to your skin, repairing all of that and helping to increase and enhance your ability to neutralize free radical damage and reverse signs of aging. So on a superficial level, talking the most superficially, just enhancing blood flow to your skin, especially in your face, gives you that youthful glow. And really, you can see this for yourself in the film that I sent you with your grounding kit. It's in the film Heal for Free. In that film, they had a patient where they grounded that patient through the bottom of his foot with an electric patch that was connected directly to the earth, and it gave only 2 hours. And this was a patient who had macular degenerative changes in the back of their eye. So you can see the blood flow in the retina, which is a really, really beautiful way to capture what's happening in the capillaries, because in the back of the retina, it looks very similar under imaging study as it does all through your skin and all through your organs when it gets down to that fine mesh, that fine capillary layer. So you can see that in the back of the eye. So they had that, and you can see this in the film that you have, the blood flow at baseline and then the blood flow after 2 hours of grounding. Even the physician, the retinal specialist, was in shock, and you can see this for yourself, had never seen reversal of damage to the back of the retina that way, had never seen increased blood flow. In areas where the blood flow is stopped, it's generally a one-way street. It's generally, as you lose your perfusion in your back of your eye, then it's a loss. And in this, it showed a reversal, and he was speechless. I think you'll be speechless if you watch it. So one of your assignments today is to watch Heal for Free and pay particular attention to that clip where we show you live in real time footage of the back of the retina and what that does to the capillary system back there. It's amazing. So we talked about skin on a sort of superficial level, just in anti-aging and increasing, blood flow and vibrancy and maybe the flushing of your skin for vitality. We talked about it in the back of the eye, so preserving eye health. And we talked about it in wound healing. So if you have skin conditions like psoriasis, or you have ulcers, or you have anything where you have a chronic skin condition, that will help to resolve it, because it will help decrease inflammation and it will help speed healing. But now let's go a little bit deeper. Let's go to muscle. So we touched on this study at the very beginning, if you remember on the first video. I'm going to talk to you about patients that were on a grounded mat doing yoga. There was 28 of them. Again, double-blind placebo study. None of them knew which ones were grounded, but half were grounded and half were not. And they had to hold strenuous yoga exercises for an hour straight. They cycled through a series of 10 strenuous yoga exercises, and they did this 5 times. So they're holding 50 strenuous poses for an hour straight, specifically to incite some muscle damage, just like in the first study. But this time, instead of looking at muscle recovery, which we know is enhanced when you're grounded, when you have an insult or a trauma to your muscles, this time we are looking at blood flow. So they're looking at blood viscosity. How does it help to be grounded when you're having some kind of damage, even if it's just minor damage like exercising strenuously? How does it help to have more blood flow to your muscles? And does it do anything to be grounded while you're doing these exercises? And it turns out yes. In the patients that were grounded while they were doing holding an hour of strenuous yoga poses on a grounded mat, all of them showed better viscosity, meaning the viscosity, the thickness of the blood was lowered, so it was running more smoothly through their muscles. And not only was it running more smoothly through their muscles while their muscles were actively engaged and strenuously working hard, the blood flow was enhanced, and it was enhanced both systolically and diastolically, meaning when the heart was pumping, squeezing, the blood flow was enhanced, and also when it was at rest between beats, the blood flow was still enhanced. So basically decreasing blood viscosity right when you're exercising, right when you need it, right when your muscles are contracting, is speeding healing and repair and buffering any insults that are coming in or any strain that's coming into your body as you're actively doing it. So being grounded as often as possible helps prep your body for anything it might need to do. Now let's go a little bit deeper. We talked about skin, we talked about wounds, we talked about the eye now, we talked about muscles. Let's talk about the actual heart, the organ of your heart. There's something called heart rate variability, and it's a marker and an indicator of heart health. What it means is it's looking at the variability between your heartbeats, and you actually want some variability because that means you're receptive, you're responsive, you're hooked into your autonomic nervous system, your body is tangibly taking in information about the environment and the stressors that you're under and responding directly to it. So there's actual variation, there's an actual interaction between your heart rate and how hard it beats and the rhythm of it, because it's responding to how much oxygen you need, what you're doing at the moment, and how you're feeling at the moment. There's an innate connection and inter-responsiveness between your heart rate and your environment, and you want that. That's a predictor of health. That's a predictor of health. And when that goes away, and it does go away when under stress, your heart starts doing a robotic kind of it's not about being in this relaxed, flexible state where you can change and respond and adapt. It loses its adaptability, it loses its ability to be responsive. It just gets into that fight or flight mode, fear mode. Stress does this, PTSD does this. You get into this sort of robotic survival mode, and that actually has been shown to decrease your lifespan. It actually is it's an indication of increased mortality rate, especially after heart attack. They look at heart rate variability and they monitor that after heart attack because it predicts your risk of death. It also predicts risk of death after a heart transplant. It predicts risk of death in premature infants. There's a lot of different clinical applications where we look at heart rate variability to predict good outcome or poor outcome after stroke, after heart attack, with diabetes. You don't want to lose that sensitivity that your electrical system has with the muscular contraction of your heart. You want that to be a beautiful, sensitive relationship where there is ebb and flow and response. When you lose that responsiveness, you become sort of in this rigid heartbeat pattern, and that is shown to be incredibly unhealthy. What does grounding do directly to your heart? Grounding directly increases your heart rate variability. So in all of these conditions I talked about, whether it's stroke, whether it's heart attack, whether it's diabetes, whether it's a heart transplant, whether you're born prematurely, whether you just have stress, whether you have PTSD, anxiety, depression, all these situations that tend to reduce your heart rate variability, earthing gives it back again. So what they found was for every single patient, when they were grounded for those 40 minutes, their heart rate variability increased, meaning their responsiveness, their ability to adapt, their adaptability, their sensitivity to their own autonomic nervous control was enhanced, which means, as you know, we just talked about enhancing their long-term survivability, enhancing their recovery from major diseases, in predicting a longer lifespan, and decreasing stress and wear and tear on the heart. When they were ungrounded, their heart rate variability went back to baseline or was unchanged. And this was statistically significant with every single patient. So when they were grounded, their heart rate variability truly, truly was enhanced. And when they were ungrounded, it wasn't. So imagine sleeping in a state where for an entire night your heart rate isn't not only protected and enhanced because it's being grounded, but then it's able to use that heart rate variability that is strengthened to then, as we've already talked about, deliver the blood to the entire body, including your skin, including your muscles, everything that's going on with your body, because your blood vessels are more dilated. Those capillaries are flowing blood more smoothly. So everything is enhanced, not everything from the heart rate itself, to the ability to deliver that blood throughout your entire body. And the last piece of the puzzle is, let's talk about the blood itself. The blood itself, the red blood cells that are in your blood, have a connection and a responsiveness to being grounded. And it's just awesome. It's awesome to see how one system can be impacted by grounding, not just through one way, not just because the heart works better, but through multiple ways. So the heart works better. The blood vessels deliver blood more easily. The viscosity is going down, so it's a more freely moving blood. And now the red blood cells themselves are less likely to clot, and let me tell you why. There's something called a zeta potential, and it's an electrical potential on the membrane of your red blood cells. And when it's negative, the more negative it is, the more likely your blood cells are to flow smoothly. And when it decreases in potential, it means that there's less negative potential on the membrane and they're more likely to clump together and aggregate. So you are at a much higher risk for having stroke and heart attack and all kinds of cardiovascular disease because this zeta potential went down. So even if we just reduce it down to looking at a red blood cell, it sounds so ridiculous compared to how beautiful and miraculous grounding, transforms your entire body. But if we just take it down to that red blood cell and just look at the little electrical potential on the membrane of that red blood cell, that zeta potential, they looked at 10 patients and they grounded them for 2 hours. And after 2 hours, they took blood before and after when it was ungrounded and grounded. And I'm going to show you the video clip below because it's amazing. You will see the transformation right before your eyes. Ungrounded, the red blood cell zeta potential was decreased, making it much more likely to clump and move slowly and form clots, which obviously, I'm sure you understand, is life-threatening to have blood clots. 2 hours is all it took to have the zeta potential increased, which means those red blood cells were flowing freely and much less likely to stick together, and your clot risk has decreased. So if you have any kind of circulatory problems, any kind from a risk of stroke to a risk of heart attack, you really want to consider grounding as a primary treatment for making sure that your blood is in a nice flowing state, much less likely to clot, much less likely to stick together and cause end organ damage. And I mean, that's really the goal of aspirin therapy when people use that for heart attack prevention, is the aspirin is anti-inflammatory and it's trying to go in there and make sure that your blood does not stick together and does not clot. But earthing does that naturally, and it does it without spending money on a drug and without GI side effects and without overdose risk. It's just natural for your blood to flow more smoothly, for your red blood cells to not aggregate and stick together and clot as much, for your heart function to be enhanced, and then for the flow through the capillaries, through your entire vasculature system to be open and free. So I have a lot of different links for you below because there's lots of different directions you can take this. We talked clinically about how grounding impacts the heart. But if you want to go a little bit further, I'm going to give you a link to my blog post about why intuitively the strength of our heart is our flexibility. It's about that heart rate variability. It's about being responsive and connected to our environment around us and to others around us. It's about using that strong electromagnetic heart field to really use it as a strength. And I show you how, and I talk to you about how in my articles on the intuitive strength of your heart. And along those lines, gratitude puts you right there. Gratitude puts you in a place of heart strength. So if you want to strengthen your heart, also click on the link below where I have a free printable gratitude journal activity for you. That's part of your homework assignment. So for today, really like you to print out that gratitude list and spend a little bit of time journaling from a very heart-centered place. And then physically on our heart, I'd like you to go outside, and I'd like you to take those 20 minutes and directly connect to the earth. Then indoors, my assignment for you is to have your wrist strap or your indoor grounding, whatever you use, with you. And when you're in the midst of something emotional, where you know your heart rate variability is going to be decreased because you're either scared, you're upset about something, maybe you're angry about something. Sometime when you get triggered today, hopefully you have a great day, but at some point you'll probably have some kind of emotion where it's feeling stressful, even if it's just stress, even if it's happy stress, like you're moving to a new place that you love, or your job's switching, or you got a promotion, but it's stressful. When you're feeling that place of stress, for anything from just a little bit of tension, a little bit of worry, a little bit of anxiety, all the way up to a panic attack, I want you to use that moment to ground. That's your homework assignment in the next 24 hours. Find a moment where you're particularly emotionally charged and ground then, and see if you feel a difference. And you can do that indoors, or you can go, if it's a full-fledged panic attack, I really encourage you to just go outside and touch the ground. Lay on the ground, put your chest on the ground, and you will absolutely feel a difference. You'll know exactly what I'm talking about when I say that the earth comes right in and supports the health of your heart and its function physically, and helps you recover from emotional stress, physical stress, physiologic stress. It really enhances your recovery and the strength of your heart. So I want you to find some emotional way to use that today. I want you to also just enhance your health all over, like we're doing all week long, by connecting to the earth outside for 20 minutes. If you liked sleeping grounded, do that again, absolutely. But I wanted you to overlay on top of that the gratitude list, and I wanted you to lay over on top of that trying to ground when you're in emotional or physical or physiologic stress, and see what that does for you. And then meet me back here tomorrow. Tomorrow we're going to talk about how earthing supports your metabolism, and how earthing supports weight, and how earthing goes deeper to fulfill these cravings that we have inside of us that we just can't seem to satiate any other way. Grounding will satiate those for you, and I'm going to explain why tomorrow. See you then.